Let's cross to our national reporter, Paul Hawkins, who joins us from Downing Street this morning. Good to see you, Paul. There you are. Look, is this a bit of a gamble from Boris Johnson as cases are surging to just ride it out, as he says?
Yeah, he doesn't really have a choice, to be honest. Very good morning to you, Isabel. Yeah, he doesn't really have a choice at the moment because, according to most experts, even if he were to try and impose Plan C measures anyway, it'd be pretty pointless now. The window for those Plan C measures to have any sort of effect has passed, really. And what we're looking at now is the key bit of data that they're looking out for is over 60s, really. In London, which is a canary for the rest of the UK, rates of COVID are now falling amongst the 20 and 30-year-olds, but in over 60s, it is still rising. And so they're going to wait to see whether that rise in cases amongst the over 60s translates into hospitalisations and potentially also, of course, because of their age, because of their vulnerability, also into ICU admissions. And that's the key bit about this wave at the moment. It is that whereas with previous waves we were looking at a link between rising COVID infection rates, hospitalisations, ICU admissions and deaths, that chain of that link has now been broken, and really hospitals are seeing large numbers, but in general wards with COVID and not in ICU units. That still has an impact on how the NHS fares, of course, and the NHS struggling as well with a staffing shortage. But yeah, this wave very much different to the previous ones because Omicron, of course, a much milder variant but far more transmissible.